Namaste friends, welcome back to our channel. Today we'll be discussing around the topic of challenges and the solutions for young doctors who are starting their medical practice. So in India the number of doctors are increasing. That is, as per the WHO recommendation, there should be one doctor for 1,000 population. Already we have reached that goal. Still, the number of medical colleges are increasing and the production of the doctors are also increasing. So with this, the competition, the starting a medical practice in India will become more and more challenging. This will happen more so in metros first, then it will be followed in the second tier and third tier cities. And this will force the doctors not to choose metros in future. The doctors from the metros will start coming down to the second tier cities. The cities, second tier cities, doctors will be start going down to the villages and town. Now, having said this, there could be a lot of problems in terms of availability of the facilities there for treating the patients, but this will happen. Now, so this is the one part of the challenge that the medical doctors will be facing in coming future. Now, all this said, that we can't stop this challenge, that is number of increasing doctors, but as an individual, what we can do, how to improve our practice. See now, when you start your practice, to get the first patient or first few patients is the most difficult thing. It is not easy. Of course, if you have got an established nursing home which is built by your parents or somebody, where the clients are always there and you go and sit there, the patient flow, same patient's flow will come to you, you can get your initial patients. But if you are the first person who is starting the practice, naturally you open your clinic and sit in some place and start your facility with all the gadgets that you have bought. To get the first patient walking in is not easy. There will be many things. More often what I have seen is the first few patients that come to you are the most challenging ones. These are the ones who have visited many doctors. They are the ones who are doing window shopping. These window shopping patients are the ones usually are the ones who have a disease which nobody can treat, or who has a disease who can't afford getting treated, or these are the ones who have created problem in some other hospital. So these are the initial patients more likely that you are going to get. So you need to stay watchful when you are starting your practice. Initially these kind of patients, if they are coming, especially the third one, the patient who is quarreling. If he has squat and quarrel and he comes to you with complaining or other doctors, there is more likely that he may do the same thing on you also, because you don't have any reputation now. Whatever reputation he passes, that becomes a brand. So naturally a patient who is complaining on others, in that comes his initial stage of practice. Try to stay away. Don't try to grab that patient. Be careful about it, because he can be very dangerous patient for you. Now, if you get a patient who can't be treated, in such a situation, at least what you can do is stay compassionate. If you have some modern treatment which you have learned, and if you think you can treat with little risk, probably you can take the help of the one more person and treat that challenging patient. But be careful, see to it that if you are treating such a patient, see to it that you give results, not complication. Because you give a complication for the patient who has been discarded by one more senior consultant, and you will get very bad name. You will get such a name that the big doctor had told not to do, but this new person came and did all this mess. So this will give a very bad name to you. The second one I said about the finance. Okay, here you have got some choice. Now naturally the senior doctor would ask some X price, and he can't afford. But you, being a younger one, you can reduce the price initially. You can reduce the price and treat that patient, of course without compromising quality. Treat that patient and get the sort of a rapport or a good rapport. At least get one patient who are treated initially and send him. So initially, if you are cost cutting, initial stage I'm telling, of course this is not sustainable in the long run. Initially, if you can compete a little bit in the cost with the senior doctor working, you said naturally the senior doctors will charge more because the amount of expertise he has got, amount of clientage he has got that right to do it. But you as a younger one, if you say this, try to put your price very high initially, I'm telling you, you may not get the patient. Of course, there could be sort of a marketing techniques can be there. There are some marketing techniques where you can say, I will do this instrument, that instrument. The new laser therapy has come. With that, I'll be doing. So naturally, because of that, the cost is up here. Even with this, I'll be doing the treatment to you with whatever the senior doctor told to do. Without that, such things you can do, and you can get your first client. So that's how you can get your first client. Second thing I was to tell you about is being compassionate. Now, see to it that when you are getting a first new patient, you got to be compassionate. You will not have a lot of surrounding people or the helpers who can talk on behalf of you, who can make the environment around that to feel good life. So it is all up to you to make them feel good. You should make to feel them good that the patient is being taken care of, and you need to instruct them everything, right from the diet, discharge instructions, what all is there. If he shows some old tablets, you have got to see them what the old tablets. Nowadays, the patients, you write some prescription, they will go to Janavadoshadi and get some different brand. He will put it right in front of you. You will find it very difficult to know what molecule he has bought. You should be very carefully check them what has been written and is the same medication is there or not, and assure him yes, it is the same medication. Yes, it's okay, you can take this drug also, although the whatever brand name your written was different and what the patient has brought is different. If it is molecule is fine, you accept it. Don't try to say no, I want this brand only, unless it is a very important drug. Usually these patients who go to Janavashadi, they have got a financial crunch. So now asking them, insisting them on the branded ones will make them feel bad. They may find you an expensive doctor. So naturally you will have to accept the expensive doctor. So focus on your this part also. Be compassionate and give a discharge instruction which is very clear. Explain them everything. Explain them about the diet and give the diet chart. Actually, you should be using EMR. I am talking about EMR in further. The EMR, which like Nice HMS, will generate the diet for you. See what has happened is with all the patients, most of the patients we are having NCDs. I mean non-communicable diseases. They will be having either diabetes, hypertension, kidney disease, transplant, and undergo angioplasty, something. Because of this, their diet modification becomes very important. So naturally, you need to tell them the diet. So this diet, you can't tell them everything. For that, the software is there like Nice HMS, where you can generate diet for it. We put the weight, height, and the type of the diet, what type of patient is taking, his daily day, what all he eats in the morning, afternoon, evening, and everything. Take them down, put it, and press a button. It will give the diet in the language that any Indian language you can output the diet. So it will give a 7-day meal regimen to him. This giving such a diet to the patient will help him a lot. It keep him happy, because the most common thing the patient is going to ask you before getting discharged is, sir, what diet I should have? And as a medical school student, you have never been told properly or taught the diet. You will not be told. You are only told about the medicines. As far as detailed diet recommendation, we have never been taught. So please read ICMR guidelines. Indian Council of Medical Research has prescribed the Indian guidelines, the diet part, how much it should be, how much percentage of should be carbohydrate. It has to definitely not more than 45% of the diet should not be more than carbohydrate, it should less than that. It has beefed up the protein and it has reduced the fats. So the major focus these days on diet is reducing the carbs and asking the patient to take vegetables. Asking the patient to take vegetables like what do you say, green leafy vegetables. They are form around 500 grams per day. That means per patient it is a half a kilo of vegetable he has to take. That is a recommended diet of ICMR. These things please go through that ICMR chart. And in fact, the Nice HMS, wherever the diet is being generated, it does check this and gives the output, the diet. So that's how you should discharge or send the patient. And the third part is investment, return on investment. Naturally, when you are done your MBBS, you are done your post graduation, you are invested. You are invested naturally. Some if you have got it through merit, fine. If you got it through payment, or then your investment will be in crores. Apart from that, you would have invested even in your clinic or healthcare, where you need to meet the ends. Initially, to meet these ends is very difficult, I tell you. You'll not be, even if you're doing it on rent, you can't pay the rent. So for that, please visit surrounding hospitals, and where they will use some patients, you can see the patients there, that will get some compensation. I do understand in surrounding hospitals, nursing homes, they will undermine your name there. They may not show to the patient what work you are doing. They will never try to project you. Still then I advise, go there, see the patients and come back. Somehow the patients are smart enough, they will find you. Where are you? With time, those patients will come to you. Of course, there will be some hospitals which don't mind undermining your name. So please visit the surrounding hospitals. Always do that. And fourth part is importance of EMR, electronic medical record. So please use electronic medical record in your practice as a beginner. Because this is very important. Now India is moving towards digital India. Healthcare is getting digital. Government of India has launched Ayushman Bharat digital mission. It will become digital India now. So your prescriptions are to be given digitally, and it should be ABHA compliant. Try to have a software which is EMR, which is ABHA compliant, like Nice HMS, which is ABHA compliant, and it has got AI powered. Here with being ABHA, all the patient's records can be kept in vertical. Like even if you are shown in some other hospital, you can suck that patient record here and you can study. And with the help of the AI, you can review the patient fast. That's all is important. Always see to it that EMR is used, and there are a lot of AI implementation in a Nice HMS which will help you to write a prescription properly. So I have done one more video on how discharge card generation is also done with help of AI in Nice HMS. Please, I'll put the link below. Please check that. And the last is some strategies that you can apply. See, the strategies is marketing. See, what is marketing? The marketing is the first marketing is patients mouth to mouth marketing is the first, best and the largest. And apart from this, if you can appoint some PRO who is going to visit nearby general practitioners and ask them to refer patient, they should come to know that you are there practicing. Unless they know you, they will not send. So this is also equally important. Always see to it that you send your PRO and ask them to come. Send the refer patients. And apart from that, you can visit a nearby place. Like if you are there in a district headquarters, go to Taluka headquarters, once a week and ask some practitioner there to correct patients of your specialty. You see them and come. If that treatment, if they require some treatment, for example, if you are a cardiologist, you go there, see the patient. So when you see the patient there, the patients may require interventions like angiography, or that patient may require some endoscopy or some intervention. For that, you can pull them to your clinic. Thus, you can build up your practice. And this is how you can start your practice as a solo. And all this time I told about solo practice. One more way of doing practice is group practice. If you can make a group practice, joining 4-5 people of different specialties, so that is also much fetching, because the lot of interdisciplinary references will be there. One-to-one mouth publicity becomes very fast, and it will help you to grow the practice very fast. But when you start your group practice, choose your partner carefully, because there should not be any difference of opinion later. If you end up with a difference of opinion later, and that will have very bad impact on the market. That's all for today, and kindly subscribe to our channel. And if you got anything extra to add apart from this, please do write in the comment. Thank you once again.